Okay, hello. Okay, class. So today we're going to talk about the CMAA, the Certified Medical Administrative Practice Test. This practice test I have purchased from, I think it's NHAP, National Healthcare Alliance Professional Organization, which is NHAP now.org. I made specific copies for my students here, for the ones that I teach to at the campus. Well, I cannot give out free copies. All my YouTubers out there, I love y'all to life, but I can't do that. So I would really admonish you to purchase your own copy from the testing agency that gives you your certification. So I don't want to get any, how can I say, copyright trouble for doing that. Okay, so however, you can glean and learn from the YouTube video that I am creating for my students so that they can look at this over and over. And for those who are challenging the CMAA certification exam, you're more than welcome to watch with us. You're more than welcome to email me. You know my email by now. It's thcod@hotmail.com. That's my personal business consulting email. And just reach out to me and say, hey, Ms. Harper, I have a question, yada, yada, yada. Okay. So I teach the medical business office professional program here at Houston Community College. I also teach at another college, which is same or similar to this, which is the medical coding and billing program. They're same and similar, just two different schools. And so the reason why I'm doing this certification is that some things that I lecture are not necessarily all 100% on the test. Sometimes some things that are on the certification is on there, but it may not get touched in lecture. So that's why I'm touching on it now so we can discuss it in class. I also have some side notes that my previous students have written up that I'm sharing with my students. Now, those I am freed and permitted by my previous students to share with you. I can share this with you, but I can't share the other publication. Okay, that's a copyright law, and I don't want to be in trouble with that. Okay, so what we're going to do is go over the CMAA practice exam. Now, you're probably wondering, well, Ms. Harper, I'm listening to you on the YouTube. Why should I purchase that? Okay, I say for me, I'm right-handed, so I'm a right-hand person. Everything I do is in the strength of my right hand. Okay, so I believe your hand, when you write, is connected to your brain. Okay, whatever you write, something is connected to your brain, and so when you purchase such notes from the actual testing agency, and you're writing your own personal notes on here, you're going to memorize it a lot better because you've written it with your hand. Your hand is connected to your brain. Okay, and I'm a firm believer of that, and it works. Okay, so please, I really admonish you to buy your own personal copy. All right, so what we're going to do is I'm not going to write on my board this morning because I got other stuff on it, and I'm having another speaker to come in later today, and she really needs that information. So I'm going to do the best that I can to discuss it and probably portray it from the test paper itself. So I have my students. So say good morning, students. Good morning. Okay, fantastic. Okay, so I'm gonna get my lighters and I'm gonna get my pen and I'll be right back. Okay, I am back. So I have my handy dandy highlighters. I find highlighters very effective because it makes things stand out of what you're trying to learn and memorize. I have a whole bag of them. Love them. Love them. And have more bags at home. Okay, so the CMAA practice test. Now you're probably wondering, what does CMAA mean? I'm glad you asked. CMAA means, make sure this chair not, okay. CMAA means Certified Medical Administrative Assistant. Certified Medical Administrative Assistant. So, what this allows you to do is to have an active role in a physician's office where you have certified knowledge in medical coding, medical billing, you have certified knowledge knowing how to verify insurance, how to explain how the insurance plans work and the products. Some of the products that I've mentioned to my students times before are like your HMO, your PPO, your point of service, your EPO. Those are your products, okay? Your insurance plans are Aetna, Cigna, United Health, things of that nature. So once you've gained experience in this, and these are my fresh new babies, all my students are my babies. So once they come out, I really tell them to sit in your position for like at least 6 months to a year to kind of horn in on your craft, know what you're doing, understand the routine and the requirements to help you understand what adjudication of a claim process is from beginning to end. Beginning is at the time of the appointment being made to the front desk, to seeing the doctor, to the end when the patient walks out. And then that's when the administrative flow kicks in, where we close out everything from the end for the end of that business day, and we do our processing of billing, coding, and then billing, and then we send to the insurance company. And then once we send through the insurance company, within 7 to 14 business days, not calendar days, business days, we should get an EOB back or some sort of response back saying your claim is going to either be paid, pinned, or denied. Okay. So within that functionalities, there are different roles that are played, okay? And then you have the leadership role of the supervisor, and then you have and or the practice manager. And the practice manager is the overseer of the practice. And so they're going to make sure that the practice runs smoothly. If there's any delay in the patient seeing the doctor, if the doctor is running behind, they're going to make sure that they come out and make that known to the patients if they want to stay and wait or reschedule. They kind of take the brunt of the hit and not allow their workers to be inundated with that so that they can continue to focus and do their job effectively. Okay. All right. Also, in the role, you have your front desk clerk, you have your insurance verifier, you have your person that does referrals and authorizations, you have your person that posts payments and does collections or accounts receivable, you have your person that does appeals all day long if something is paid incorrectly or not paid at all. You have your correspondence team that answers requests such as coordination of benefits or release of information in case the insurance company needs more documentation to say they need to justify why they need to pay this claim. Okay, those type of positions or roles are necessary in the office of a certified medical administrative assistant. These are folks who do the administrative task of the office, and it also takes the work and the thought of it away from the nurse and the physician so they can do their clinical work effectively with patient care. Okay. All right. So, ladies, let's look at number one. Number one says, so I'm going to kind of scan through some of this. The test itself has, okay, there's 235 questions on the test. I'm not really sure how long the test is. I have to go back and read how long the test is. I think it's 2 hours long, and I think it's about 100 questions. So you have about 235 questions, which some of these questions may populate and some of them may not. So I want you all to study and be familiar with that. My suggestion is that once you study these questions, please make sure that you take your test right after. So you can sign up for the test like right now. You don't have to wait till September 12th or after September 12th to sign up for the test. You can sign up for the test right now and set your goal to take the test like 1 or 2 weeks after you have completed studying. And my suggestion for that is because once you are so focused and concentrated in your studies, that information is in your head. I want you to take the test and study up until the day before you take the test. So, in other words, if you take the test on Friday, study up to Wednesday. Okay. Breathe, relax, try not to let anything distract you. No family drama, no mama drama, daddy drama, kid drama, no none of that. Okay, try to avoid that. Go to bed early. Be mindful of the fact that, if it's cold, you may want to bring you a jacket, and kind of situate your personal body temperature to the room. They do have to have the rooms cold for the sake of the computers. Okay, so kind of be mindful of that. All right, so number one, it says a provider is running 30 minutes behind schedule because of an early morning emergency. Which action should the medical administrative assistant take to maintain effective scheduling in the office? Okay, so Shaylee, I want you to give me, the answer is written in black. So you give me the answer to that. Okay, great. So have y'all ever encountered that before? So you can kind of judge and see from the question is really kind of common sense. All the questions are going to be multiple choice. So all you multiple choice test lovers out there, this test is for you. Okay, for you people. Okay, I prefer essay writing. I'm a passionate writer. I love writing. I'm very passionate about writing. However, essay is not my choice of test method. But hey, it's out there. It's not what I like. It's what majority likes. Okay, so great. It's pretty much a common sense question. Do y'all see how that goes now? Okay, number two. Ebony, read number two.
A provider acts as medical administrator to schedule a surgery to remove a patient's gallbladder. The assistant should schedule the patient until the following.
Okay.
Cholecystectomy
Mm-hmm.
is a surgical procedure that removes the gallbladder and any gallstones it contains.
Okay. Wonderful. And so you all have learned earlier from medical terminology what cholecystectomy is. Okay. The removal of what? The gallbladder. Okay. Removal of the gallbladder. So you're going to have those multiple choice answers. So it's pretty much easy. Number three, Amy. Mm-hmm. Very good. Very good. Now, this is answered and written for the sake of the test, but in reality, you do take a message, you do confer with the physician, but 9 times out of 10, the nurse is the one that's going to make the call about it. Okay, unless it's something really pressing and urgent, then the physician will. But other than that, it's the nurse. So that's reality. I don't want to confuse your minds. I'm just explaining something. So maybe I shouldn't have said that. So, but anyway, but for the sake of the test to be correct, yes, this is the answer you want. Okay, got it? Okay, Shaylee, number 4. Mm-hmm. Okay, fantastic, fantastic. Okay, so we're going to kind of jump around here. So I'm going to highlight that we have done number numbers 1, 2, 3, and 4. Okay. Let's kind of jump around to page 1 because we'll be all day going through pages 1 through 25. Ebony, start with number 13.
Prior to an invasive procedure, a patient asks a medical administrative assistant about what options that are available. Which action should the assistant take? Advise the patient to ask the provider about alternatives. Is it the provider's responsibility to explain alternatives to the patient?
Okay, great. You see how common sense that is? Okay. All right, fantastic. Number 16, Amy.
After reading the security system, which action should a medical administrative assistant take next when opening the office door? After the answering service, check the answering service to see if there are any messages from the previous season.
Okay, fantastic, fantastic. Shaylee, number 17.
Which abbreviation is aggregation? POS.
Very good. It's an open HMO. Very, very good. Now, remember earlier on in class, remember I said a point of service plan, it is an open HMO, but it has the best of both worlds. It's open to where one side of it you can use in network as an HMO, okay? And then if you should choose a doctor that's not within the HMO network, you can choose another physician that's in the PPO side, which is out of network. Okay. And then that's when the PPO side will say, okay, then we're going to pay at a certain rate. We're going to pay at a percentage. You have to meet a deductible because you're going out of network. Okay. So it's the best of both worlds. It has the open access of HMO and PPO, the point of service plan. It's the most expensive tier when you're applying for benefits. Okay. So, all right, very good, very good. Okay. Is it Ebony? Okay, number 18.
The patient's chart indicates the need for PT as a result of a muscle. The medical administrative assistant should recognize the abbreviation PT as which physical therapy. PT is the abbreviation for physical therapy, which is a rehabilitative treatment for a strained muscle.
Very good. That was kind of right up your alley, right? Okay. Okay, fantastic. Amy, number 20. Very good, very good. So you have claim adjustments, and it says here, and I'll say it a little bit more on this side. The EOB details the insurance carrier result after processing the claim. The EOB explains what was charged, what the insurance covered, and what the guarantor owes, including any adjustment based on the allowable amount charged for services. So basically, your claims adjustment. And we haven't gone over claims, so I need to really kind of remember to do that right quick at some point, maybe next week. So somebody please remind me, Ebony, remind me to going over the how to read an EOB. When you have claims adjustments or when it says the term discount is interchangeable, but they mean the same thing. So what ends up happening is saying the insurance is not paying for this adjusted amount, or the insurance is not paying for this discounted amount. Okay. So even though the patient may have paid a $40 copay or may have paid their 20% for the day, when you get the EOB back with the check and you post their payments on the system, you have to email. I'm sorry, you have to bill them the adjusted rate or the discounted rate, so they're responsible for that. So the physician can get their whole 100%. Does that make sense? I know you're hearing me, but you'll see it more effectively on the EOB. So just remind me, Ebony, to do that. Okay. All right, number 21.
What is required to establish medical necessity?
Very good, very good, very good. Okay, let's look at number 23, Ebony.
Which allows employees access to information regarding workplace safety, right to know law.
The right to know law, which allows employees access to information regarding workplace safety. Very good. So like if you're working in a laboratory, you need to know what are their procedures? You know, how do they dispose of things? You know, they may say, well, you're asking too many questions. You're kind of nosy. No, I just need to know because, hey, I'm married and I got kids. Or I got kids and hey, I got to be there for my kids, you know. Sometimes even like where my husband works at ExxonMobil, he has to know what type of chemicals he's mixing, what type of chemicals he's working with in the laboratory. And then he has to know what I think they call it PPE or something, what type of gear he has to use because you can breathe something you can't see. You know, you can actually touch something you don't think is harmless, but it is. Okay, so it's very necessary. Even as minute as you think it is at a doctor's office, it's very necessary. Okay, very good. All right, let's look at number 24, Amy.
Medical administrative assistant is reviewing the review one application with the the assistant should ensure that all the following the legal custodian, the person has custody of the minor from 4 to 6 hours.
Very good, very good. As you all know, we live in the state of Texas. The age of 18 states that anytime a child turns 18 years old, they are now a consenting adult, that they have the right to speak and care for themselves. Okay, unless you know, now if they're under 18, if they're 17, they're still considered a juvenile. Okay, if they're 16, they're still considered a juvenile unless they are considered an emancipated minor. An emancipated minor has to be a decree and declaration by the court, and they have to show proof of their declaration that they are an emancipated minor. Does everybody understand what I mean by emancipated minor? Meaning that they show proof that they've been caring for themselves, that, you know, the parent or the legal custodian has given them permission to be an adult. Okay, so they have to have those legalities decreed by the court. Okay, other than that, it's just hearsay, it's just talking, honey. I can't take your word. It has to be in writing. Okay, all right. Oh, number 25. Let's look at number 25, Shayla.
Based on Harper guidance, a medical administrative assistant should take which of the following safeguards a work ensure the privacy of patients' records. The assistant should either log off or log in to the meeting.
Very good. Ladies, whenever you leave your workstation, always do what? Sign off or Control Alt Delete. Those three keys, you touch them all at one time. So if you do, not right now, but if you can remember, Control Alt Delete. When you hit Control Alt Delete, it's going to give you some choices, whether you want to log off or you want to, I can't remember, something like that. lock your computer, I think. And so you want to do that. Why? Because your log on is still active. And anyone can come behind you if it's not activated to log off itself within 5 or 10 minutes. Anyone could come behind you and go on your email and start sending out stuff in your name. You know, people can go and start doing work in your name. That IP address will read that it was sent from your computer under your login in your name, okay? And you want to be careful of that. If you're working the front desk, ladies, make sure that there's some sort of screen protector on your screen there. Make sure that when you work in dealing with patient paperwork, make sure that when you have other patients that are crowding your desk, that you turn it over so that they don't read pertinent information. Okay, you always want to be kind of HIPAA compliant and HIPAA aware. Okay, so yes, please lock your computer. Sometimes you have folks at work, Lord, 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 that can do some stuff, and you go into the restroom, and it don't take them long. I know, because I've been in corporate America 32 years. I know. Okay, let's look at number 27. Next person.
Which prefixes mean mostly.
My. Very good. Very, very good. Let's go to the next page. Okay, number 29. Very good. Very good. I know sometimes we can get captivated on the nice smell of gladiolas and roses, but everybody, you don't want to be a cause of someone's allergic reaction. Also, while I'm making that note, you don't want to be the cause of someone's headache if you're wearing loud perfume. Okay, I know I'm a perfumaholic. I'm guilty of that. So if you're a Bath and Body Works kind of a girl, what's the other one? Bath and Body Works, and then there's another one else. Victoria's Secret. What else? Other little girly stores. You know those girly stores, you know, that sells that kind of stuff. You know, it's nice to wear that. Just be careful. Just be careful. Okay. All righty. Let's look at number 33.
For medical billing purposes, physicians follow and practice request verification of current patient information.
Remember I have said that? Why should you do that? Does anybody remember what Ms. Harper said about that? Yes, because their benefits could be expired. They can work this week and then be fired next week. Okay? You always, you know, and they can move, they could be at this address today and move next Wednesday. You got to make sure that every time they come in, that they fill out a form to say, is your insurance the same? Yes or no. Is your mailing address the same? Yes or no. Okay. So are y'all getting a feel of how these questions are? It's kind of. Exactly. Now, when y'all get ready to take the CCS exam or the CPC exam, should you choose to go further in the next 4 or 5 months of that program, yeah, then it's going to be exactly what your mind thinks.
So taking this course will certify us in all these or just?
It'll certify you just in the NHA. It's just one of. I put those on there because I don't know which one you're going to get, you know, that you want to go for or stick with. And you're not limited. You can take 3 of them. You can take 2 of them. You're not limited. They're similar, just the agencies are different. Okay. You like NHA's website? Okay. Okay. Yes. 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 So you can have the one from NHA, and you can also have the one from NCCT, or one or the other. You don't have both. Mm-hmm. Is that interesting, sweetie, Shaylee?
Okay, so when we, for example, if I take the CMAA
Mm-hmm.
certification, the other two,
If you take the CMAA certification, then you can acknowledge that one on your resume and delete the other ones. Mm-hmm. Mm-hmm. Or you can say pending if you want to do it for later. But if you're just taking that one, that's it. It only covers for one. Mm-hmm. Mm-hmm. Okay, fantastic. All righty. So let's go to number 37.
A patient presents to the provider's office with daylight symptoms. Which action should the medical administrative assistant take first? Move the patient to an isolated location. In an isolated area, the patient can complete paperwork away from other possible immune compromised patients.
Mm-hmm. Immunocompromised.
Immunocompromised patients.
Mm-hmm. 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 Very good. Very good. Number 38. Okay. Okay. Very good. All right. Number 39. Maintaining day sheets. The day sheets is what they're talking about, appointment schedules. Okay. Same thing, interchangeable words, but they mean the same thing. Okay. Next, number 40. Mm-hmm. Andra. Uh-huh. Uh-huh. Number 35. Mm-hmm. Okay, very good. So y'all see it again. Verify coding compliance and resubmit the claim for adjudication. So again, that's part of the appeal process. Appeal process. Okay, let's go on to page 5. Page 5. Number 42.
which action is appropriate for clinical and administrative assistance to take on providing instructions to the patient allow extra time to reinforce the instruction. Using the extra time to process the information will provide comfort and the opportunity for the patient anxiety to decrease. The more anxious the patient is, the less likely he is to understand.
Very good. Very good. Number 43.
Which word groups mean swallow? Bang.
Beige. Uh-huh. Beige. Beige. Okay. All right. Number 46. Lapro. Laparo. Okay. Very good. Number 48.
Which is the primary reason for medical administrative assistance to document show and to maintain schedule and integrity, the patient allows the provider to monitor
Okay. Okay. All right. Number 50.
Which phrase indicates a biohazardous waste container? Red. All biohazardous waste containers must have a red label with the biohazard symbol and the word biohazard in a contrast color.
Okay. Okay, very good. Okay, so let's move on to the next page. Number 52. Okay, very good. So did y'all understand that? Did y'all capture that? Okay, it says, which is the amount the medical administrative should submit to the secondary insurance carrier? Okay, if the encounter balance is $360 and the patient has two plans with an 80-20 split. So $72 is the amount that represents the 20% that should be sent to the secondary plan. 20% of 360 equals $72. Does everybody understand that? Okay, okay, very good. Remember when I went over and I talked about the job being a secondary biller? Okay, that's what a secondary biller does. They take the EOB from the primary insurance and they refile it with the secondary insurance. Okay, so that job title is known as secondary billers. They deal with that. Yes, ma'am.
Quick question. See how I say 80-20?
Mm-hmm.
The last number, is that always the percent that they are gonna pay?
Yes.
That always be the number that we multiply with, like the total bill?
Yes.
Okay, so the 80 is just there saying,
The 80 is what the insurance is going to pay to the provider.
okay.
The 20% is what the patient has to pay.
Okay.
Yeah, the patient always pays the lower end. If it's a 70-30 plan, who pays the 70%? Who pays 30%?
The patient.
Okay, if it's a 90-10 plan, who pays 90%? The insurance, okay, and who pays the 10%? The patient. Very good, very good. Okay, all right. Okay, so let's look at number 55.
Which of the disease causing organic?
Mm-hmm. Pathogen. Okay. All right, number 57.
Which is the most effective way for a medical administrative assistant to reduce the number of no-show appointments. Call patients 1 or 2 days before a scheduled appointment. Call 1 or 2 days in advance. The patient is more likely to remember the appointment and still allows for time to fill the schedule if the patient is unable to keep it.
Okay, very good, very good. Number 58. Okay, very good, very good. Let's move on to page 7. Okay. Let's do number 61.
When preparing a claim, the medical administrative assistant should use which of the following month, day, and year. This format is page 1 to page 8.
Very good. All right. Let's look at number 63.
Which type of referrals is used in emergent situations? Stat. A stat referral is used in emergent situations as indicated by the provider after referral is faxed to the review department. It is approved over the phone.
Okay. Number 64.
How to describe screen scheduling. Patient appointment is for screen their face scheduling gives patients specific appointment times. This system works best for schedule for adequate time
Okay. Number 65.
When a provider requests a patient to have a diagnostic test at a hospital, which action should the medical administrative assistant take? Schedule the test with the
Okay, very good. Um, Number 66.
The medical administrative assistant makes arrangements for a staff member to attend a conference, which is the most important step for keeping the office informed. Distribute the travel
Itinerary.
itinerary, ensuring the office staff is informed about the dates and times of travel is the most important step. With knowledge of travel itinerary, the office staff will be able to make adjustments to the schedule. So there's a minimal disruption to day-to-day operations.
Okay, very good. Very, very good. Okay, so let's move on. Let's skip a page and let's go to page 9. Let's go to page 9. I'm getting sleepy. Ooh. Okay. Let's look at number 77. 12 months. 12 months. Very good. Okay. Let's look at number 79.
The traffic procedure is outside the scope of practice signing for a court order,
Subpoena.
issued for out. The court order subpoena must be directed to the provider or administrator.
That's right. That's right. Never do that sign for a court order subpoena. You should give it to your practice manager or give it to the physician because that's someone that's in suit of that practice, of that physician, and that physician needs to be made aware, why are they wanting request of my work on this patient? And I need to know what's going on, and they need to know what they're sending out. Okay. All righty. Very good. Okay. Number 80.
The medical administrative system receives telephone calls from 4 patients. Which call indicates a need for a patient.
Mhm.
A patient who reports difficulty breathing. A patient who has
Hey.
an impaired airway requires immediate attention.
Mm-hmm. Okay. Okay. Very good. Very good. Number 81. Okay. Okay. Very good. Number 82.
Which actions is appropriate for a medical administrative assistant to take before scheduling. Verify the patient's status. The assistant should verify the patient's insurance prior to scheduling surgery to ensure benefits.
Okay. Very good. Let's do number 83.
Before adding medical records to a patient's chart, the medical administrative assistant should take which actions? Ensure the provider has initial report. The actions ensure the provider reviews the report prior to the assistant placing the report in the chart. The action is necessary for legal compliance.
Okay. Let's skip to page 13. So let's kind of skip around a bit. Let's look at number 113. Okay. Number 114.
Which of the following parties of Medicare paid for hospital? Part A, pays for inpatient services such as hospital, skilled nursing care facilities, hospice,
Okay, very good. So we know that on Medicare, Part A pays for a hospitalization. Okay. Part B, in a physician's office is what pays for the physician's care for Medicare. Okay. Part A pays for hospitalization for Medicare. Part B pays for physician office visits for Medicare. They have $100 deductible normally, and then they pay 20%. Okay. If they have Physicians Mutual or AARP, then that would be a secondary insurance. And you can file, once you get your EOB back and the payment back from CMS, you can file AARP or Physicians Mutual second. Okay, does everybody understand that? So anytime when you work in a physician's office and a patient presents to you a Medicare card, that means that you're going to deal with Medicare Part B. Okay, if you're going to admit a patient in a hospital and they present you a Medicare card, you're going to deal with Medicare Part A. Okay, Medicare Part D is like prescriptions, other stuff like that. You know, A and B is your major concern. Okay, fantastic. Okay. Hold on. Let's look at number 118.
It is appropriate for a medical administrative assistant to release test results to the patient's family. The patient provides a signed release of information that identifies the family.
Very good. So remember what I said before, as an example, if there's a husband and a wife and they're on each other's insurance, okay, well, let's say this. If there's a married couple and she's using her husband's insurance and she had a pregnancy test done, and the husband is curious because he's gotten some sort of notification or some sort of indication that she was seeing an OB-GYN doctor, and he calls the OB-GYN doctor's office wanting to know what was his wife being seen for. Can you release that information to the husband? Unless it's stated on that release of information form in their chart that he is able to have permission to access her laboratory results and all of her patient care, then he has a right to know. But if he does not, if he is not placed on there as a person to know, then you cannot let him know what that is. You would have to redirect him and say, sir, I'm sorry about that. Your wife did not sign you on the release of information form here at the doctor's office. You would have to ask your wife that question, okay? Vice versa, even if it was the husband and the situation was reversed, they would have to ask the husband that question, okay? All right, fantastic. So that's real important because you can mess somebody's life up giving out information and they're not privy to that. Okay. All right, fantastic. All right, so let's skip around again. Let's go to page 15. Let's do 135, number 135.
Which of the following is the most efficient method for a medical administrative assistant to collect payments for services? Collect due amounts at the time of the patient's visit. This is the most efficient way to collect payments for services because it does not add unnecessary time.
Okay, very good. What's number 136? Can someone read that? Who's next? Very good. I know my physician, Dr. Chang, he has open hours on Fridays. I like that. I didn't know that until I called one Friday. I wasn't feeling good. That was great. Okay, number 137. Very good. Very good. Please, ladies, do not do that. If there's any addendums that need to be made in the electronic medical record, if there's any corrections that need to be made, please let the physician or the nurse make that. There is a proper procedure. I think I went over that before, where you circle the error or you add the addendum and you have to include the initial or your name, the initial of your name and the date, and the addendum, which is the addition to whatever is missing from that chart or any changes of that. If there was an error made, you have to circle the error, you have to cross it out, put your initials and the date, and then the physician would have to write the correct information, or the nurse does. It is not your job to make any documentation changes. It is for the clinical practitioners to do that. Okay, that is a legal and binding document, be it electronic or paper-based. It's a legal and binding document. Okay, does everybody get that? Okay, fantastic. Okay. Number 139.
Which of the following is the best way for a medical administrative assistant to address collections of copay? How would you like to pay step? This is the best way to address collections of copayment. It is easier to collect from patients at the time of service.
Okay, very good. Very good. So you make sure when you ask the question and you're working at the physician's office, make sure that you ask the practice manager or the physician what method of payment are they willing to accept. Are they willing to accept check, cash, or credit card? Okay. If they're going to accept cash, do they have a check verification system that they use to make sure that the person doesn't have any outstanding checks out there in the system? Make sure that you ask the doctor. Sometimes patients may want to write a post-dated check, because they may see the physician on a Wednesday, but they don't get paid till Friday. You have to ask the physician if it's okay. Now, don't make mention of that voluntarily to the patient. Only ask the physician that question if the patient asks that, but that's inside information for you. Okay. If the patient says, well, I want to give a debit card, but I don't get paid till Friday. That has happened. And to one of my clients, what I've done, I made a copy of the debit card on one of those debit card transaction thingies and told them that we'll run your card through on Friday, your payday, for this amount. And I made them sign that. Okay. Sometimes you have to get your patients to sign and verify that they're promised to do something, because words in court don't mean nothing. Okay. It's just hearsay. You got to have that in writing, black and white. Documentation is everything. Paper trail is your world. Okay. All right, let's move on. Let's skip about another 3 pages because we have Miss Orday here. Hi, Miss Orday. How are you? I'm fantastic. Will Mr. Lewis be joining us today?
Yeah, we're not supposed to be here till 11, but
Okay.
my ride this morning was so smooth.
Oh,
I'm
wonderful.
just sitting here learning what you all.
Okay, fantastic. Okay, all right, fantastic. Okay, and so we're gonna keep this going. So we're gonna kind of skip around to page 17. And as I've said out there to my YouTubers, I'm not going through the whole entire package of this certification. I'm only skipping through pages, going through certain questions. So you would have to go through the testing agency, which is nhanow.org, and request your copy. Okay. I'm just going through this for review's sake to allow my students to see how easy this test really is. And it's basically common sense. But if you've gone to your schools, whatever school that may be, you've been lecturing, you've been lectured to, you have taken the initiative to read, because learning is also self-practicing, meaning that you don't just come to class and wait for your professor to lecture you. You also take the self-initiative approach by reading. And if you're not understanding, then you come back to class the next day and ask your professor about it. That's how the school world works. Okay. Um, so I'm just going over a few little things here with my students so that they can get acclimated to how the test is written. And I hope and pray you would do the same as well and be just as successful as they will be. Okay, concluding. We just had this conversation earlier today, y'all. Who's doing number 150? Who's next?
An emancipated minor is scheduled for an amniocentesis.
Very good.
Which of the following forms of consent is required for this procedure? Informed consent. Informed consent ensures the patient understands the risks and benefits of the procedure. An emancipated minor can sign an informed consent form for herself.
That's right. We just finished talking about emancipated minor. Okay. And again, in the state of Texas, every state is different. Okay. I have a cousin that was in the system, and I think he was in North Carolina. And once he turned 17, they're declared an adult. So, but he found his way back down here to Texas, praise God. And so now he's under care again as a minor, and he's, well over the age of 17 now. But again, emancipated minor in the state of Texas, you have to be decreed and declared an adult uh, by the court system, and you have to show proof that you have cared for yourself, and your guardian has to sign off and give the court rights and permission to declare you as a legal adult anytime you're under the age of 17. Okay, so emancipated minors. Okay. Number 151. We had a discussion about that one time before. Mm-hmm. Okay, so PHI, protected health information. Okay, it should be a signed release of information from the patient. Before releasing a patient's private health information, it should be written authorization from the patient through the disclosure form. So remember, if you have new patients that have come into the office and they're filling out forms for the first time, they have to fill out a PHI disclosure form to say that they give rights and permission for whomsoever can have privy to their protected health information. Even sometimes you have some pharmaceutical companies, and I think I said it in this class, can't remember. You have some pharmaceutical companies who want to come through and get access to all those patients that are diabetic, all those patients that are heart patients, and they want to do a study or a test, to see how well that this patient will do on a new drug. The physician's office have to get permission from patients and ask their consent if the pharmaceutical company or whosoever or whatever healthcare marketing agency can have access to the information. That patient has a right to say yes or no. Okay. And anytime that you share information, you always have to let the patients know that you have shared their information. Okay? All right. What is number 154? Can someone read number 154?
Patient is allergic to eggs and therefore happens to be not sure if it's to recognize
Contraindication. Inadvisable. Very good. Because of the influenza immunization, it has some sort of egg component to it and has been tested so that the person's immune system gets injected with some sort of influenza, but yet it's training your body how to fight against it and not become so affected. Okay. Very, very good. Okay. Number 155. This is the heart and soul of where we live.
A patient should sign which of the following forms in order to authorize payment directly to the provider from a third party field. Assignment of benefits. By signing an assignment of benefit, a patient authorizes a third party field to pay benefits directly to the provider.
Very good. Remember what I said, ladies, on the CMS 1500 form, those particular number boxes that has to be signed, that has the signature on file, that certain number of box that has to be checked off. Can anybody tell me what box numbers those were?
12, 13, 27.
12, 13, and 27 on the CMS 1500 form. That's right. Absolutely. If you don't check off yes for assignment of benefits, then where is that payment gonna go? Well, it won't get denied. If that payment goes out and box 27 is not checked off, what's gonna happen to that payment? It's gonna go to the patient. That patient is gonna get a check in the mail from Blue Cross Blue Shield telling me, ooh, I received a blessing. Ooh, I've been blessed. I've been blessed. Yes. Ooh, thank you, Jesus. Okay. And then what's gonna end up happening? You're gonna have to request for the check back. You're gonna have to call and say, ma'am, sir, did you happen to receive a check from Blue Cross Blue Shield? Yeah, I did, but it's mine now. I done cashed it and bought me a Dooney or bought me a Coach bag and some perfume. Ma'am, that we're sorry to say, but that check belongs to us. Well, honey, that's not my problem. You need to take that up with Blue Cross Blue Shield. Okay? And sure, you can take that up with Blue Cross Blue Shield, and you're gonna have to be patient, and they're gonna have to, on their part, send out a letter to request the money back from the patient. But at the same time, the next time you file claims, they're going to withhold the amount of money that accidentally went out to that patient. They're going to withhold that amount and pay you whatever else is due until they get that money back.
Is the patient like legally responsible if they don't return the money back?
Yeah. If they don't return the money back, you have every right to send a collection to them. Send a bill to them. Ma'am, sir, this has not been paid. We have contacted you. The insurance company, they're gonna say, we have contacted you, so therefore you owe us $395. What? I owe y'all? Yes, sir. Yes, ma'am. You owe us that. Okay, fantastic. Number 157. Very good. Very good. Number 158.
In case you call to request that our immunization record be emailed to her, which of the following actions should medical administrative assistant take first? Check the patient's file for writing verification. The patient must sign and release of information from before the assistant is sent.
Okay, okay, very good, very good. So yeah, I'm starting to see a trend of private health information throughout this test. Have y'all noticed that? Kind of release of information, all that good stuff. Okay, very good, very good. Number 160.
A patient will pay $15 each time used in treatment. The medical administrative assistant should recognize this amount if applied to each of the following parts of the patient's insurance payment. Copay. Copay is a fixed amount that policyholders pay each time they receive a service.
Very good. It is a fixed amount. It is a fixed amount. Very good, very good. Okay, number 162. Okay, okay, very good. Number 163.
Which of the following should the medical administrator the assistant should include a national provider
Very good. They have made that a big deal to use since 2005 or 6. They no longer use physicians' social security number. It's very risky to do that. So now they put them in what they call a database. All of their social security numbers, their business tax numbers, their EIN numbers. Um, they put all that in a database called the NPI, the National Provider Identification. And each, once they're put in the database, they're given an EPI number, which is safe for them to use, and it secures the patient, the physician's information. Okay, so you all will be very familiar with that, especially if you're going to work on the claims side. So now you're on a, if you choose to work on the opposite side of the river, if you will, uh, then instead of working on the billing side, you may want to be a claims examiner at an insurance company. So when you're working at an insurance company, you're going to be privy to use an NPI database that would have all these physicians. And when you get ready to process that claim or pin that claim or deny the claim, you're going to be able to find that physician's name and their NPI number and process the claim if it's not already on the CMS 1500 form. It should be on the CMS 1500 form. Okay? All right? Very good. Okay, let's look at number 164.
Insurance policies contain which of the following provisions to avoid overlapping payments? Coordination of benefits. By deciding which third party is primary and which is secondary, the coordination of benefits controls insurance carriers, expediters, and prevent overlapping payments.
Very good. Number 165. Okay, number 166.
Education reports the threat which up to the day actuality assistant should direct its which of the following first person to receive the report of a violation is the applicant, who is often operating taxes and
Okay, okay, very good. Let's go to page 20 and let's look at number 177.
A medical administrative assistant is working with anyone who is receiving care after delivery of pregnant. Which of the following describes the mother's condition? Postpartum. Postpartum is the period after delivery.
Okay, very good. Well, okay. Look at number 181.
When the insurance carrier has made the provider with the policy to the credit remnants, advice to report them to the provider that they took out.
Okay, very good. 182.
These schedules are based on which of the following? RPRGS. These schedules are based on resources-based relative value.
Very good. And remember when I said the RBRVS affects how the CPT code, the procedure codes are rated in price, okay, which is set and declared by HCFA, Healthcare Financing Administration, which is fathered by CMS. Okay, very good. All right, let's look at number 185.
Which of the following parts of Medicare offers prescription medicine? Part D.
Mm-hmm.
Medicaid Part D provides reimbursement for prescription medication.
Mm-hmm. 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 All right, number 187.
Medical administrative assistant.
Okay.
For the
Okay. Okay. All righty, number 189.
Medical administrators a specialist office scheduling and at HMO insurance. To the following should a primary care provider is
Okay, very good. Number 190.
A patient who has oral infusion needs therapeutic procedure to remove the unknown fluid. Which of the following describes the procedure that the provider performs on the patient? Thoracentesis.
Thoracentesis.
Thoracentesis is a surgical function to remove the from the lungs.
Uh-huh. Very good. Very good. Number 191. Okay. Okay, very good. So PAR provider, remember what I said? A PAR provider is one who contracts with an insurance company, a third-party administrator. A non-PAR provider is one who does not contract with an insurance company. Does everybody get that? Mm-hmm. Okay. Let's look at number 195. I think this one is kind of cute.
which is the following action, which is the following action should a medical administrative assistant take when answering telephone calls for the third ring?
Mm-hmm. Answer by the third ring. Because if you take too long, somebody's going to complain. Nobody's answering the phone. How come every time I call, nobody's answering the phone? Every time I come in here, Doc, nobody wants to answer your phone. What's wrong with that? Okay. They're going to make it known somebody's not doing their job. Okay. All right. Number 197.
Which of the following forms is currently used to submit claims for hospital services and procedures? The UB04 form. The UB04 is a standard form that hospitals, skilled nurse facilities, and home health agencies use to submit claims.
Mm-hmm. 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 All righty. Let's go on to the next page. Number 204. Subpoena. Okay, when a court requests the record through a subpoena, in which of the following situations is it allowable to release a patient's medical record? When the court requests the record through a subpoena. Remember, anytime there's a subpoena being brought to the office of the provider, you have to let the practice manager know, and you have to let the physician know. And then once they know about it, then they will give you directives on how much information to release. Okay? Okay, very good. Let's go on to the next page. Number 213.
Which of the following legal terms describe a situation in which the failure to exercise treatment causes harm to a patient?
Negligence. Very good. Negligence. Okay. Number 211.
Which of the following information is applicable to the court on a patient's financial appointment?
Yes. Yes. Number 214.
Which of the following should be obtained prior to committing the
Very, very good. Number 216.
Which of the following comments by the medical assistant is perfect to say when informing a patient of payment responsibility? Your copay is $10. Someone like to pay that today. This describes the amount owed and inform the patient that is due on the day of.
Okay. Very good. Very good. All right. So we're going to skip around. Let's go to the next page here. Number 222.
Medical administration scheduling a patient for a requires a 12-hour fast. And which of the following times should the assistant schedule the diagnosis test? At the beginning of the day. The earlier part of the day is the best time to schedule appointments for patients who are fasting.
Okay. All righty. Number 223.
Please give me a minute while I review it.
Okay, very good. Number 226.
A provider notes a large hematoma on the right forearm of the patient during examination. Using the SOAP method of documentation, in which of the following sections of medical record is the information objective? The visible hematoma is clinical evidence and belongs to the objective section of the.
Okay, very, very good. Very good. Okay, and let's move on to the last page. Okay, number 229.
When you make a message for a patient regarding a upcoming appointment, which of the following information should the medical administrative assistant include in the message? The name of the practice. Remember, messages should include the name of the practice and the time of the upcoming appointment.
Okay, number 230.
Parameter measures the function of which of the following. Parameter is the device that measures the air control and
Okay. Number 231.
The patient has a diagnosis of Parkinson's. Medical administrative assistant should schedule a patient for an appointment which of the following specialists? Neurologist.
Okay, very, very good. Number 232.
A provider is called away from the office because of an emergency. Which of the following actions should the medical administrative assistant take first? Away patient options for rescheduling.
Okay. Okay. Number 233.
Which of the following methods is appropriate to use to remind the patient of the appointment that is scheduled
Okay, okay. Number 234.
Advance necessary notice informs patient that a service is not likely to be covered, but which of the following insurance may. The end is used to confirm that a patient understands the procedure may not or will not be covered by
Okay. And number 235.
Which of the following actions should a medical administrative assistant take when scheduling a new patient for a physical examination? Inform the patient of the appointment cancellation policy. Canceling an appointment incorrectly can create a financial obligation. Therefore, the assistant should inform patients of the practice cancellation process and policies in scheduling the appointment.
Okay, very good, very good. Okay, ladies, give yourselves a hand. Y'all kind of went through the test. Now y'all have an idea of what the test structure is like. And again, it is multiple choice. So take your time in reading the questions. Don't just rush through the questions, rush through reading it, and it's not saying what you think it's saying. Okay, I know I've made that mistake times before myself in taking multiple choice questions. So sometimes I would flag a question, come back, and then take my time and reread it. And then once I reread it, then it's like, oh, okay, I read that wrong. Oh my God, how did I miss that? Okay. All right. Well, this has been all for the CMAA certification review. I wish all of you out there in YouTube land to do well on your CMAA National Certification Exam. Again, if you have any questions for me, feel free to contact me, and that's thc@hotmail.com, my business email. It's been a pleasure as always. And remember, this is Miss Tara Harper coming to you live for your health information. Thank you so much.